Good afternoon, everyone. I'm going to call our Reentry Network meeting to order, and I'm going to ask first that we take the roll.
All right. Chairperson Chavez.
Here.
Thank you. Member Johnson. Here. Present. Thank you. Member Tomalinas. Absent. Member McGowan. Absent. Member Williams or Member Lee is absent. Member Burchard.
Here.
Thank you. Present. Member Cody is absent. Member O'Neill.
Good afternoon, I'm here.
Thank you. Present. Member Rosen or Member Angel is absent. Member Nikolai.
Here.
Present. Thank you. Member Little or Member Shing. Absent. Member Terrell.
Here.
Okay, present. Thank you. Member Mills. Absent. Member Bunduris. Present. Thank you. Member Gaxiola is absent. Member Fisk.
Present.
Present. Thank you. Member Halcon. Present. Thank you. Member O'Brien. Present. Thank you. Member Amador. Present. Thank you. Member Yee. Present. Thank you. Member Clifford is absent. Member Mukoyama.
Here.
Present. Thank you. Member Manley.
Present.
Present. Thank you. Member Hernandez is absent.
Present.
Oh, present.
Sitting over here, sorry.
Oh,
To your right.
oh, to my right.
Oh,
Oh, okay. I'm so sorry. Thank you. Present. My apologies. Okay. Member Day and Member Parumatam are both absent. Member Loftus? Thank you. Member Brahim? Present. Thank you. Member Mata or Member Joseph? Absent. Member Wiggins? Present. Thank you. Member Miranda is absent. Member Kendrick is absent. And Member Ellenberg
Yes. Sorry.
is present. Thank you. You have a quorum.
Thank you so much. We're now going to go to public comment, and this is open to folks to speak to an item that is not on the agenda, but within the purview of this committee. Do we have any public speakers?
All right. We do have one raised hand on Zoom, but none in the room.
Thank you. We'll take 2 minutes for that public speaker. Thank you.
All right. So our first speaker is Paul Soto. Paul, we are unmuting you. You will have 2 minutes to speak. The timer will begin when you begin speaking.
Good afternoon, Judge Manley and the members of the Reentry Network. Paul Soto from the Horseshoe. I'd like to talk about an experience that I had with the faith-based programs. Now, I was able to do the work in order to get established a curriculum that would involve San Jose State University students. 12 of them are going to be participating in this endeavor. And it's going to be to research 3 men, Fred Ross, Father Anthony Soto, and Sal Alvarez. Now, when I went to the guy did not believe that I was part of the syllabus. I didn't follow the syllabus. I'm actually in it. He didn't believe that I was capable of that. Then I talked to Javier and I told him how insulted. I said, hey man, come on. How many people do you know that come in here into the reentry and reach this level? Now, come on, man. All I'm looking for is some resources, man. I need some clothes. I need a computer. I need some flash drives. It's legitimate what I'm doing. It's in the fall syllabus for San Jose State University. And Javier told me, with that much information and that much legitimacy, Javier told me, we got a clothes closet for you. We got to go to a clothes closet. And I said, no, that's not acceptable. I ain't going to no clothes closet with the amount of resources that I'm eligible for in this county and the kind of work that I do in this county. I had that coming. And what he did is he denied me And he kept telling me, well, I need this proof. I need this proof. You don't need no better proof than the syllabus for the fall semester at San Jose State University with this project in my name in it. So there needs to be some kind of amendment of that kind of treatment to people that do the work.
And that concludes our speakers.
You. We're going to close the public comment section, and now we're going to go to approving our consent calendar. Our item on consent is the quarterly dashboard from DRS relating to the Reentry Resources Center statistics. I'm going to ask if there are any comments or questions on that item.
Move approval of the consent calendar.
We have a motion. We have a second. I'm going to see if there are any public commenters on this item.
We do have one hand raised virtually, but otherwise none in the room.
Thank you. We'll take that public speaker.
Oh, okay. All right. Our next speaker is Paul Soto. You will have 2 minutes, and we are unmuting you. Please accept the unmute. You will have 2 minutes. Okay, Paul, I believe we have given you permission to talk. Go ahead.
Is it clear? Can you hear me now?
Yes, we can, Paul.
Thank you. Thank you. Paul Soto from the Horseshoe. I read the report. What I'd like to point out is that in order to really have measurable results, metrics, you have to follow the person and follow a particular group over a 10-year period of time. Now, I know we want that immediacy in terms of result, in terms of getting a human being that has experienced treachery, racism, witnesses to suicides, extreme amounts of violence by the guards and the inmates. And when the symptoms of that kind of exposure starts to surface within the context of their reintegration process, we call that a failure. It's not. It is not a failure. Because the person, you're not taking that into account. You're not taking into account that the system itself is diseased, and what the person is coming out with is an infection, and that infection surfaces in their relationships, surfaces in their unemployability, surfaces within their drug addiction, alcoholism, and so, and that's why Judge Manley is a saint of the body. He is a saint because he was the one that stood there and said, no, I'm not going to criminalize these symptoms because I know where they stem from. Thank God for Judge Manley, because that's what he did. And he saved this county hundreds of millions of dollars because you're not treating more severe symptoms than you normally would have had they been sent to prison instead of Judge Manley's court. So I'd like to just suggest that we take that into account, that when we measure outcomes, we have to measure them over 10-year periods.
Thank you, and that concludes our speakers.
Thank you. We're going to close the public hearing component and see if there are no other comments or questions. I'm going to ask for all those in favor to say aye. Any opposed? Any abstentions? Seeing none, we're going to move on to item 4, and this is to receive a report from the Office of the Division of Reentry Services related to the transition of Reentry Resource Center to a no-entry facility.
Good afternoon. Javier Aguirre, Director of the Office of Diversion and Reentry Services, and with me is Chad Martins, our Assistant Director of the Office of Diversion and Reentry Services. And then with me too, and I'm going to ask Robin Daniels-Wilson from Behavioral Health to join us for this discussion. And we unfortunately don't have a member from our VHHP MMU today, but if there's any questions regarding the medical mobile unit from this report, we could definitely follow up on that. This report is a response to a board request to look at how we serve folks defined as a no entry, so a no entry model, which we identified back in 2020 as we were developing the 3-year strategic plan. And as we define no entry model is one that helps people prevent people from being incarcerated in the first place. So just wanted to remind this body in terms of the flow of our two reentry resource centers, one here in San Jose and one in Gilroy. And we primarily serve individuals that have recent involvement with the criminal justice system. As you may recall, when we first created the Reentry Resource Center, we did limit it to the individuals that were just being released from jail and prison within the last 12 months. And since then, it's any individual with a criminal justice history, and we are doing the outreach for those individuals that are in custody and those that are being connected through any of our collaborative courts or any of the court departments. In the last few quarters, we did see an increase in the number of individuals coming to our San Jose Reentry Resource Center, and that is aligned with all of our outreach that we are doing in the community. We have a community outreach specialist in Palo Alto Courthouse, and we're expanding the services down in South County. Part of this report, we wanted to let this body know in terms of the services that are already available for the no entry effort. So basically individuals that have no history of the justice system, but we are intending to prevent them from entering into the justice system. So we have the behavioral health services on site, and they provide linkages and treatment referrals. And so the targeted population, of course, is the justice-involved individuals, but any individual that comes to the Reentry Resource Center experiencing a mental health crisis will be triaged regardless of their justice-involved status. So again, any individual that comes to the Reentry Resource Center experiencing a mental health crisis will be triaged to the behavioral health team. Another component at the Reentry Resource Center that support individuals that were preventing them from getting involved in the justice system is our healthcare system, our medical mobile unit. And it has a full-time doctors, psychiatrists, nurses, and social workers. They're on site. And in the legislative file, you have a description of the hours and the service that they offer at the Reentry Resource Centers in both in Gilroy and in San Jose. Again, individuals that do not have any history in the criminal justice system and are seeking services through the healthcare program will be seen by the health services, by the medical mobile unit. Another component that we identified as a service that we support individuals that we're preventing them from going into jail is our Mission to Recovery Station. As you know, we established that back in the fall of 2017, and with the initial partnership with all of our law enforcement agencies to prevent people from being incarcerated in the first place. And the initial focus was folks that were publicly intoxicated that were being brought by law enforcement agencies. Since then, we've expanded to folks that have experienced any mental health crisis under the influence of drugs, and our partners have now increased to the behavioral health providers, our emergency departments, and any community organizations that are case managing individuals through the county partnerships. In the fall of 2023, as a matter of fact, just on Monday, October 16th, we launched a new partnership with San Jose Police Department. It's a pilot project. It's a misdemeanor driving under the influence cite and release pilot program. And that is focused on a specific population, and that's the first-time misdemeanor DUI arrestees. So they'll still go through the same process, but in lieu of being brought into jail, the police officers will bring them to the Mission to Recovery Station. And on Tuesday, we had our first participant from San Jose Police Department. If we were looking at expanding services to individuals not in the criminal justice system, so any specific other targeted population, we would be looking at how we would expand services with the behavioral health team and with our Office of Supportive Housing and with the medical mobile unit. Just looking at the data from the last fiscal year, behavioral health has been reporting to various board committees in terms of the number of contracted capacity and how many individuals they've served. So in the last year, they served more than what was in the modality contracted slots. In order to refer, and if there is an increase in individuals coming to the Reentry Resource Center, the behavioral health team would most likely refer clients to other locations where there are in-person assessments or direct clients to utilize the behavioral health call center. With housing, as many of you know, housing is one of the critical needs of all of our reentry populations. If we would expand that to any individual that has no connection to the criminal justice system, we would have to look at, work with all of our partners at the Reentry Resource Center to conduct additional housing assessments. And then the Office of Supportive Housing would also be increasing training and support to partners at the center to conduct formal housing problems solving sessions, which already do occur with the staff from Office of Supportive Housing and some of our case managers, case navigators. But if we would need to increase that because of the volume would increase at the Reentry Resource Center, we would be asking our partners to identify additional staff. And then lastly, in terms of the medical mobile unit, so if we were to expand additional targeted populations outside the justice system, we would be asking the medical mobile unit to consider looking at expanding the services. But in conversations with the medical mobile unit, they're already at capacity. They're already referring clients to other VHHP programs and to other parts of the Santa Clara Valley healthcare system. So that's something that they would be doing as well. And then the legislative file does talk about the board approved a feasibility study that is currently being undertaken by Facilities and Fleet to look at a new reentry resource center. We're literally maxed out in terms of space. We're looking at potentially medical social detox in one of our office wings. So we would be having to look at relocating staff. Part of the feasibility study is to look at the additional targeted population, how would that new center will look like. So with that, we're open here for your questions. Thank you.
Thank you. I'll first see if there are any comments from the public, and then I'll look to my colleagues for comments.
We do have one request to speak virtually.
Great. We'll take that public speaker.
All right. So our speaker is Paul Soto. Paul, we are unmuting you. Please accept the unmute. You will have 2 minutes.
Thank you. Paul Soto from the Horseshoe. Rarely do I hear a report that is that hopeful, that is that successful, and that really accurately is assessing the need of the people, of the population that are channeling out of the probation system or the parole system. Because when you go to a regular clinic, there's a certain kind of demeanor, a certain kind of a dissociation that you experience. That's not the case when you go to the reentry. So if you have a history of being incarcerated, if you have a history of being on the streets, they already are familiar with that history. So they're sensitive to it in a way that other clinics will not be. So whoever came up with this idea, I will do everything that I can to provide you what the information is necessary in order to ensure its success. The other thing is that with the mental health wanting to lock people up to get them treatment, this population is going to also be the beneficiary of this too. So CalAIM monies can be used in order to support these programs because they're going to need housing, they're going to need clothing, they're going to need resources in the community. And you have to find a funding source so that it doesn't take away from the funding that's already available to the people that have been locked up. But excellent, excellent news. Thank you.
And that concludes our speakers.
Thank you. I'm going to close the public hearing, and I'm going to look to my right to see if there's anybody who has comments or... Sheriff?
Yeah, actually, Javier, I really appreciate the report. And what it reminded me of, especially when you were talking about the ability to redirect people that have mental health issues, not incarcerated. I'm curious, and I'm assuming some of that data included our work with the PERT program, and if not, that's another piece of information I think would be valuable, because we've had that program. For those that don't know, that's where we have clinicians from behavioral health in our cars with the deputies. We only do it in the West Valley, but it's been in place for over 2.5, coming up on 3 years now. And there's substantial data there showing how effective that program is to diverting people away from criminal activity, getting them the services they need. So I'm just curious if any of that was part of this, or if that's additional data that we could bring to the...
That's a great question, Sheriff Johnson. So we could look at the data that we receive regarding the admissions to recovery station, because some of the PERT team members will utilize the admissions to recovery station to stabilize an individual prior to engaging them into treatment. But we could definitely also work with behavioral health to see if any of the PERT clients also were routed to the behavioral health team at the Reentry Resource Center.
Yeah, because the reason I bring that up is I think it's a conversation worth having, because we're seeing that now play out. And, you know, in our county, we right now for Santa Clara Sheriff's Office, we have just in the West Valley, but there's still a substantial amount of calls that they're responding to and providing resources, and very rarely, and I think maybe only a couple of times, they've had to lead to incarceration. So it seems to be working out, but what's promising is if we can continue to build on that and redirect individuals, especially those having mental health issues or a crisis, I think we'd be better off as a county as a whole. So again, thank you for the work you do.
And Dr. Terrell wanted to give you feedback.
Yeah, thank you for that question and comment. I agree. There's quite a lot of information that we have been able to collect. One, with respect to our implementation of 988, so that's the call-in line where we can respond to mental health crises. That in and of itself is an opportunity to divert people away from incarceration or law enforcement, because we are oftentimes able to de-escalate those situations via phone. And if not, we do, in fact, as you're stating, send out our mobile response unit. So it can be our mobile crisis response, as you've referenced, Sheriff, our PERT teams. We've also implemented Trust, which many of you are aware of, which is a non-law enforcement intervention in the community as well. So I think taking a look at all of those efforts collectively really will further contribute to being able to articulate our efforts around diversion of individuals away from the law enforcement.
And I apologize for popping back in, but yeah, I really, and I've said it before, but this body probably knows better than I do, but I think this is a program or a tier of programs that I think really should be considered a model, because I'm not familiar with any other county, at least in California, that has all three tiers in place, meaning a trust program, a mobile response team, and a PERT law enforcement component as well.
No, I appreciate that comment. I do think that's fairly unique in our county and across the state to be able to offer multiple levels of intervention through mobile response. And so your point is well taken, and I think that's certainly something we should begin to spotlight a bit more and be able to highlight the data and efforts that that's yielding. Thanks.
Molly?
Thank you. Javier, thank you for the presentation. I think we should all be really happy that you're bursting at the seams and at capacity. It just means we're helping community members. I had a quick question about your slide on behavioral health services. I think you said that you're over capacity in treating mental health clients coming in by about 500, and that the plan for the moment is to refer people to other places and agencies. And I just want to say from experience, you know, in the public defense world, when we refer people, like formerly we would refer people for immigration help out of our shop, and they get lost, and I know we all know that, but I'm hoping that even though you're at capacity, the solution involves getting someone in-house since you have, live people with live problems at that moment at the building.
Yes, so that's a really good question in terms of the behavioral health. So the component that we were looking at is more of the assessments. So the in-person assessments, the behavioral health team there then will refer clients out to the community for actual treatment services. But I could ask Robin if she has anything to add in terms of her team, what they also do in terms of if they're at full capacity and there are clients that need in-person assessments.
There we go. I couldn't really speak to that right now, but I think maybe we could get back to you with any questions that you have on our capacity at the Reentry Resource Center to do more assessments. I think the data you presented is the most up to date.
Right. I'm gonna go to Wes, and then anybody else. Okay. Go ahead, Wes. Yeah.
I have a couple comments. One, there was it's mostly for San Jose City, but there was an article in the Mercury 2 Sundays ago about the rise of violent encounters with police, even though they get the CIT training. And they did say, I must say, for mental health, that it has been a good program for mental health, but the number of violent encounters with the police in San Jose have risen instead of gone down. And one example was this woman who had a drill, and it looked like a gun, and she was pointing at people, and then the police who were up front knew what was going on, and they were holding things. But then another wave of police came, and from the second tier shot and killed the woman. And there was another one with a guy named Gwynn. But I think we still need to look at violent encounters with the police. And secondly, a question I have for you is, and Javier, you may not have control over this, but the assessments when people are intaked into the jail, how thorough are they? And I wanted to talk to Judge Manley about this because I'm a clinical social worker, and I'm also a chaplain in the jail. And one of the inmates that I've been seeing for 3 or 4 years, when he first came in, he had no idea he had a mental health issue. But I would think that they would thoroughly assess him, but they didn't. And after 3 months, I learned he was hitting his head against the wall, and he was crying out a lot. And so I asked him, and then he had problems on the unit itself. And I asked him, what's causing you hitting against the wall? And he says, I hear voices. And these voices tell me to do that. And I can't stay away from them. So I called within the jail the program people, and it took a long time to come in. And I also learned that medication is not given to anyone who comes in until about 2 or 3 weeks after they're intaked. So one day they found him, he was hitting his head against the wall, and the guard called. And they finally took him, and it took a while for them to give him medication. He is on medication now, and he doesn't hear the voices as much. And he was given a sleeper, a trazodone, for his sleep because he couldn't sleep. But this torment had gone on for 2 or 3 months with him, and I wrote a letter to the judge about what I had discovered, and I sent it through my chaplains as well.
So Wes,
And he got So I need to take this aside with you, or?
Yeah,
Okay.
the topic in front of us right now is for the
Yeah, but
reentry
I-
center.
I'm wondering about the assessments, though.
So
My
for-
question is about the intake assessments.
For the reentry center,
For- No, not
for the jail.
when they come in.
So what I'm gonna do is, I don't know if we have anybody from booking here, but if we don't, if I can get them to come before the end of this section, but we can certainly follow up with you on that. Right now, we're focused
Okay,
on the
all right,
reentry
fine,
center.
That's fine.
Rose?
Thank you.
Of course.
More than one van, or how many vans are
Can
there?
you, Rose, there's a mic right next to you. No, the light's on. Can you just move that mic? Just move the base of the mic to her? Thank you.
I wanted to know how many vans there are available, and also, if you could recap, you said there's doctors, nurses, psychiatrists, what was, can you go over that again, please?
Yes,
Thank
if
you.
I understand your question, you're referring to the VHHP medical mobile unit on site. So yep, it is one mobile unit. And as you can see on page 4 of 5 of the legislative file, there's a table in terms of the medical provider, which is the two physicians, the two doctors, the psychiatrist. There's also social workers and nurses and community outreach specialists that support our clients that have come in to seeking medical services. There's also part of the transition clinic care network where they're working with folks that are coming out of state prison that are coming to county as a resident, and they'll be seen at the VHHP MMU.
Thank you, that's excellent. I don't have my packet with me, so
Oh,
I
no,
don't have the
yeah.
details. Thank you.
So any other comments on this item? Yes.
Just two quick questions. For the folks going to the mobile vans, do they have health homes? It's just that making the care so convenient is what actually gets them into care. And then on the mental health assessment, is that for level of care that they're being assessed, or medical necessity, or both?
So I'll take the first question regarding the cell phones. So we do our best to provide individuals with cell phones. Is that the question?
I'm sorry, Javier, health homes. Do they have
Health
like a-
homes?
What was that?
Yeah.
Do they already have a medical home, but we're putting them
Oh,
here
I-
because of
sorry.
access
I thought we were
versus
talking about
having
cell
them
phones.
wait?
As I look at my cell phone here.
And you actually may not know the
No, yeah.
answer to that because we don't have anybody from the
VHHP, yeah. so
right
we could-
here today. But what I'm going to ask is if Javier can talk to them and then follow up with all of us. And what was the other? Beyond cell phones, health homes. Go ahead.
I think, Aaron, you were asking if we do level of care assessments within behavioral health, and the answer to that question is yes. That's the kind of assessment that they're doing. They're screening individuals.
At the reentry center?
Reentry Resource Center for Behavioral Health and Substance Abuse Treatment Services. And just as an aside, if somebody walks in crisis and they present there, they do get referred to services.
Anybody else on this item? Judge Manley? Can you turn the light on, your mic on? There you go.
Javier, thank you for the great report. I just wanted to ask you about the Recovery Center, Mission Street. You're adding now the first DUI offenders or
First time of-
individuals
yep.
who've been arrested. And of course, that's people who perhaps have not even been in our system yet.
Correct.
And I understand, and that's wonderful. But my question is capacity. Do you have enough beds and enough staff?
So currently we do, great question, Judge Manley. So currently we do have capacity. So we are moving the Mission Street Recovery Station to their new location, hoping in a matter of weeks. And that there's 20 recliners. And so we do have the capacity. And of course, if we are looking at reassessing if we're at full capacity, then we'll have to reassess in terms of adding more recliners and working with our provider, Horizons.
Thank you.
And is the new location just expanding at the current location, or is it physically a new location?
It's going to be physically a new location at the Reentry Resource Center.
Same building, okay.
Same place.
So anybody else on this item? No, okay. So just a couple things. One, I wanted to say thank you. Two, one thing I wanted to point out is that the reason we had a discussion here about creating options, just as a reminder to all of us, about having a no entry opportunity was to give the police departments options other than having to take people into custody. So what was intended to be at that location was a mental health facility, frankly, that would have capacity to act not as a booking per se, but as a place that if a police officer didn't think their behavior rose to a criminogenic level, that if they were if a person looked like they needed support and help, that they'd be able to be brought to the facility. That was the idea around no entry on the mental health side, and on the drug and alcohol side, same. Somebody who may be intoxicated needed a place to decompress and then be able to have people talk to them about services. I think the challenge here is that the opportunities are still very limited, meaning they're very small in terms of how many people can be helped or supported in this facility. And that's kind of one issue. And the other issue is that we have gotten a lot of feedback from public safety that they want us to have the capacity to engage someone for longer than a few minutes and then have them leave again and then be out on the street, and potentially even while that officer or the community was already feeling concerned, scared, or upset with that person, that we had the ability to do a better job of, not better, but have more time with the person, really, to be able to engage them. What I would say is before us today, which I appreciate, is a very clear and honest assessment of how limited the services are and that we're learning how to build them up. The reason I mention this, colleagues, is that the idea behind the no entry framework really speaks to another point that I just wanted to acknowledge, Javier, that you've raised, which is we're putting a lot of activity into a very constrained space. And the other question we haven't really thought through, I mean, I know you're thinking it through, but based on that constrained space, there are limitations to how much service can be provided. And then back to the point that our public defender raised is then if we're not able to properly assess them and we really are moving people to other locations, whether or not they actually ever get connected to services. I say all that more because one of the questions I think is really important to the next series of discussions that we're having relative to facilities and investments is, as part of the discussion we're going to be having in January, is where do we place the reentry center on the prioritization for investment, and whether or not it is a reentry center, and whether or not the reentry and the no entry can stay connected, or whether or not it makes sense to move them apart a little bit. And the thing I'll just say that I've been thinking a lot about is when you call 911, if you need to, you can go to the hospital. If you've been injured, you can. If you need mental health services and it's really acute, we'll take you to BMC as well. For 988, we don't have that interim space where someone can go that is a little more in this gray area, which is what I think, Sheriff Johnson, I really appreciated you asking Dr. Terrell, is that, who are we helping in what area? And I just think it's worth us knowing that we don't have all the answers, and I think that's okay, and that we are asking the reentry center to expand, because once something is successful here in the county, and I'm as guilty of this as anybody, we kind of say, oh, can you do this? Can you do this? Can you do this? And so thank you for all your good work, and your good work has, of course, led you to get more work. So that, not a great lesson here. But so what I say that because what I want to recommend is that this report be integrated into the discussions that we're going to have in the January timeframe around this issue. And I would also just ask, if you can, to make sure that the chart that you have on the back in terms of the data is attached to this. So you can actually take a look at how many human beings you're dealing with by program. Again, so the board has an understanding of what's the actual footprint that you're going to need to provide the services you think most need to be provided, especially as we're looking at no entry. If we really are looking at alternatives, then do you have what you need to make that real? So because I think, like I said, we're asking you to do a lot of different things, and appreciate that you've done so many of them in partnership with these great organizations. Erin?
So if I could, I adore the goal of the no entry. And I know all progress has to be incremental. But if, we have so many people who are going into jail for 3 days or fewer. And it's like, not a safety risk, so why are they going in? And I'm just wondering if there's a model that when quite a long time ago, we did a booking protocol in juvenile hall, and all of the chiefs and the sheriff signed off on it. And it was that for these offenses, we're not going to bring your folks in. But what we are committing to doing is within 24 hours after the citation, they will have an intervention in the community, so that it gave law enforcement the confidence that something was going to happen with them. And I feel like if we could move in that direction, that feels like it would be transformative and might not plug your hallways quite as much, Javier, but that would be an aspirational goal.
Yeah, I would actually agree with that. I think there's opportunity, because a lot of the things that Javier just mentioned that they're doing for the no entry are being done in the entry, right? Because we have that two-tier assessment going on. And I think that's key to your earlier comment about giving community some assurance that we're addressing it, because this is a great start, first-time DUI offenders, but that's the first time they were arrested for DUI. Doesn't mean it was the first time they'd been driving DUI. And I think it's very, very important that we have that space to look at getting them resources for maybe an underlying problem rather than the typical cite and release. So I think there's a way we can continue to expand on this concept. So thank you.
All right, thank you. I think we don't need to take action on this. Want to just say thank you for the good work, but I do really want to just make sure this gets served up as part of that other discussion so it doesn't get left behind. All right, we're going to move on to item 5. And item 5, Javier, is you again. All right. So we're going to receive a report from the office, relating to the 2-year adult reentry strategic implementation plan.
Well, thank you. This is exciting to come to this body to provide you with an update on our 2-year implementation plan. We've been doing this work since we started in 2011 with our first reentry network plan. And since then, we've developed a 3-year plan, a 5-year plan, a 3-year plan, and now a 2-year plan. And we're about to come to the conclusion of the 2-year implementation plan, which is June of 2024. So I wanted to provide you with a high-level update on the strategic plan. And in your packet, there's also a lengthy matrix, a work plan that has some details in terms of all of our stakeholders' efforts over the last year in terms of achieving some of the objectives and the goals of the 2-year strategic plan. Back in April of 2022, this body approved this strategic plan with these objectives. Then this body forwarded to the full board of supervisors, and the board of supervisors approved this plan on May 24th of 2022. So as you can see on this slide, is just some key objectives in terms of our target jail population, our recidivism rate, our efforts with the reentry racial equity action plan, are encouraging our community-based organizations to meet some outcomes in terms of employment services and also mental health or substance use treatment. So with regards to the first item, the reduction of the jail population, so I wanted to give you a snapshot of the daily snapshot from October 1st of 2023, which was 2,984. When we compare that to July 1st of 2022, when this plan was first implemented, it was 2,600 individuals. So there was an increase of 984 individuals from our stated goal of averaging of 2,000 individuals. And what I did is I kind of looked at all the various prior reports to Public Safety and Justice, to the board in terms of updates on the jail population. And here are just some highlights from those various reports. Another objective of the strategic plan is to reduce the AB 109 recidivism rate. So our focus is on the AB 109 population, not the entire general probation population, pretrial population, but focus on individuals that are identified as AB 109. And so last year we published our 10-year report, and based on that 10-year report, the recidivism rate for this population is 48%. Our goal from this body was to be at 40%. Keep in mind that at the state level, prior to 2011, we were at 65, 70%, brought it down to 56%, and now we're at 48%. So not only just all the county efforts in terms of reentry, diversion, and all the various efforts to reduce recidivism, but we also strive to look at other aspects of how we could reduce recidivism, and quite frankly, having our clients housed, treated, and taken care of through healthcare. Another component of our strategic plan is to reduce racial and ethnic disparity. So at prior reentry network, I did provide an update on those efforts. Just wanted to highlight some of those, and the one that I do want to highlight again is the county stakeholders are looking at, are in the progress to developing a county justice systems dashboard. So we're convening with our stakeholders to create that, looking at our county open data portal efforts, but most importantly, looking at what of our justice partners already presenting to the public and how we could centralize that in a one justice dashboard. Another component of the strategic plan is to ensure and work with all of our case managers, all of our partners to look at employment opportunities. So this is just some highlights in terms of what probation is doing with their contract with Center for Employment Opportunities, what we're doing with our contracts with Goodwill Industries and Catholic Charities. And then we take pride in our contract services in terms of hiring individuals with lived experience. So the last bullet shows the number of positions are created from our contracts and how many of their contracts hire former clients as part of their jobs or part of their staff, whether it's peer mentors or case managers. This slide provides you a high-level outcomes of the mental health and substance use treatment from the last fiscal year. So you could see the various treatment completions from the crisis residential, the full service partnerships, the mental health Evans Lane outpatient, and the substance use treatment services. So overall, the rate of AB 109 funded mental health and or substance use treatment is at 65%. So in your packet is the complete updates on all of the 15 different paradigms with multiple objectives. So I won't go into detail, but I just wanted to highlight a few here on this slide. The Public Defender's Office has been working very closely with all of our stakeholders to ensure that a lot of our clients' convictions are expunged. As you can see, in fiscal year 2023, the reentry expungement program expunged 2,400 convictions. We also have a strong partnership with the Office of Supportive Housing to ensure that any individual that comes to the reentry resource centers receive a completed housing assessment, which is a VI-SPDAT. As you can see here in terms of the ranges of the individuals of their assessment, and based on their assessment, they get routed to the various different housing programs. Another component of the strategic plan is to look at case conferencing, discharge planning, and so in partnership with the Office of the Sheriff, Probation, Behavioral Health Services, and Custody Health, and our Service Navigator, San Jose State Research Foundation, we've established a bi-weekly case conferencing, which we'll be discussing in more detail in the next report. And then, of course, another piece of the strategic plan is to look at how do we ensure that all other stakeholders that are seeing clients in the jail are assessing screening individuals for behavioral health conditions. So behavioral health created the brief jail mental health screening tool that now the sheriff's rehab officers and the pretrial services officers can use in custody. So as I mentioned early in my presentation, our 2-year strategic plan will come to end on June 30th of 2024. And so we're seeking input from this body as to the next steps. And with the leadership of this committee and Board President Allenberg and the board created the alternatives to incarceration efforts, and now there's some recommendations, there's an implementation plan. We're looking at how do we embed those ATI recommendations into a countywide strategic framework in terms of the justice-involved individuals, incorporating the AB 109 10-year reports recommendation, which literally was focused on increasing housing, increasing behavioral health services, increasing employment, and improving our discharge and case conferencing and doing more outreach in the community and in the jail. Another option, which can be combined with the first option, is to survey our lived experience advisory board members, our community corrections partnership, this body and PSJC stakeholders in terms of what focuses we should be looking at for the next 1 or 2 years. And the other option too is engage a consultant to prepare a new strategic plan, which we did 4 years ago. That then was the impetus of this strategic plan. So again, this, an opportunity for this body to give direction in terms of next steps as we come close to finishing our strategic plan for this 2-year plan. So with that, we're available for questions.
Thank you. I'm going to first see if there's anybody from the public who would like to speak.
We do not have any requests to speak.
Okay, we're going to close the public hearing component. I'm going to look to my right or left and see of the most opinionated people I know. Do we have opinions? Oh, there you go. Susan has opinions. There you go. Oh, I don't know what. Here.
Thank you. Thank you so much, Javier, for the previous report as well. Didn't have questions, but very, very much appreciated all of the material. Today, I want to pull out a couple of areas of the report, of the current report, for questions and maybe discussion, and I certainly have some thoughts around next steps. First, looking at the jail population reduction, very much appreciated the numbers on our population reduction efforts, and I'm looking forward to the report that's coming to PSJC next month so that we can really dig more into this topic. I was particularly interested in noting the 6 key objectives that were based on national standards in jail reduction efforts that were outlined. And I'm going to read them here. They're brief, and I think they're all really important. Decreasing jail bookings and or arrests, especially for low-level charges like misdemeanors. Second, increasing options as to release during pretrial state without the use of money bail. Third, expedited court case processing. Fourth, reduction of the length of stay in jail. Fifth, expansion of community sentencing options. And sixth, ledge changes. I think we're doing parts of all of these. And as we think about how the county can really demonstrate and visibly show progress on our justice system reform, especially ahead of the conversations around building a new jail, and how we think about the ATI work group recommendations, the existing REN strategic plan, and other initiatives, I'd really be interested in hearing administration's perspective on whether these 6 objectives might be advisable as a framework to guide prioritization of this work. And Casey, I'm particularly looking at you because of a recent conversation we had about the validity of looking at a particular number, whether it's the current static goal of 2,000 as a goal for jail population reduction, given the input, given our conversation and given the input that we've received from justice system partners on how the number of individuals we can divert from jail is dependent on the number of individuals eligible for diversion. And again, I know we'll dig more into this. Is this an area for further analysis, part of the reentry center's process of refreshing the strategic plan? Is this kind of an overlay? I'm very interested in your thoughts and anybody else's.
Yeah, I mean, my initial thoughts would be that it's a bit of an overlay. So to kind of preview a little bit of the discussion that I think we will hear at PSJC in November, the jail analysis is really complicated and very nuanced, in part because of an antiquated system that we have that tracks who's coming in and out and what they're being held for, which makes evaluation of who's eligible for diversion and may not be receiving it challenging without a literal case-by-case analysis. I think in terms of the framework of a strategic plan, I can take a look and dig a little bit more deeply and maybe address a little bit of that in the report in November and think about whether more broadly that should be considered a framework. I don't think there's anybody from the district attorneys, the prosecutor positions here today, but I have been in discussion with the district attorney's office about what it would take to do a snapshot in time evaluation of the jail population and really dig deeply into each person in custody and how we would begin to identify those people that might be eligible for diversion and for some reason are not maybe falling through the cracks or not quite getting the attention they need. Another item that I know has been raised and is progressing is a discussion with the courts and with many of the partners here about how we can get services more quickly to some of the populations we know that need the most, namely those people who may have homelessness issues, who may have mental health or substance abuse issues. The idea that's being considered is a sort of triage arraignment court where we would be able to identify, to Aaron O'Brien's point earlier, people more quickly and hopefully give them more case management, more direct service earlier on in the process to, you know, depending on how you define diversion, right? There's diversion from prosecution versus diversion from incarceration. So this would be kind of a diversion from incarceration, getting them out more quickly. And I think lessons could be learned in that pilot court that would help us identify people even more quickly, ideally, in the booking process.
Thanks. I appreciate that. And I think that though for folks that are involved in the system work, it may be clear from a public perspective, there's a disconnect between believing that our justice reform measures are working, that our alternatives to incarceration are effective, if that total jail population number doesn't decline sufficiently, stays at a higher level.
agree.
I think it's a very
It feels like
basic
cognitive
presumption
dissonance.
to say, well, you're not doing the job. So really understanding that and then thinking about other measures of success, which may be those 6 and maybe something else, but just wanted to put that out there. With regard to recidivism, certainly want to commend the work that's been accomplished by reentry services and TSS and adult probation's evaluation team to assemble the recidivism stats on the AB 109 population. We really have good data on that group, and I'll note in a moment or so that I would really like to see this level of data and analysis on our entire population. One of the statistics that stands out to me that's really striking is the percentage of people who recidivate, 65%, occurs before the 1-year mark. Over a third of those are occurring 1 to 6 months after release. And I'll note that a major motivator for my guaranteed income referral was to try to shore up the gap in services that are available immediately after release. But in the meantime, I'm curious about whether reentry services or any other folks can talk to what efforts we might employ to concentrate services around this vulnerable period literally immediately after release without any waiting time, in hopes that that will be impactful.
Absolutely. A great question, Supervisor Allenberg. And I think I'll mention two efforts in terms of how do we ensure that clients, when they get released from jail, have immediate access to services so we could reduce that number of folks recidivating. And that one piece is getting them right to the Reentry Resource Center. So we have that shuttle service. We've seen an uptick of folks using the shuttle service from Elmwood to the Reentry Resource Center and getting engaged. Another component that we're working with Sheriff Johnson and his team is to do more in-custody transition and discharge efforts. So having members from my team working alongside the Sheriff's Office, Custody Health and Behavioral Health in custody to start doing the more focused area with discharge planning, but also encourage individuals that have not been connected to connect with us through that effort inside the jail. So that's something that we're partnering with the Sheriff's Office.
Let's two parts there. First, if we need to incentivize people to go right to the reentry center, we should be thinking about that. But assuming they get there, what's available to them immediately in terms of housing, money for food, clothing, access to education or job training that starts really the day that they show up on your door?
Yep. So it's all a matter of assessment and the screening and the assessment conducted for that individual while they come to the Reentry Resource Center. If we had a panel with keys to all the various housing slots and availability to make sure that there are beds available, most of our clients are referred to the shelter for immediate housing, or if they are part of their assess and they get connected to rapid rehousing or get a motel voucher. We're going to be working very closely with the Office of Supportive Housing to ensure that all of our service navigators that are connected with the client immediately have access to more of those housing slots. We are leveraging our faith-based collaborative to look at every of their system of care in terms of if there's any housing available for our clients. So that's a housing piece. And then the employment is making sure that they get referred immediately to either Goodwill Industries or Catholic Charities to start. And as part of our report too is the employment's ESUB program for ensuring that some of our clients can get jobs with the county.
Thank you. Consuelo, is there a HUD issue or barrier for people coming out of jail? Do they not meet the homelessness definition of HUD?
Thank you for the question, Supervisor Ellenberg. Good afternoon, everybody. Consuelo Hernandez, Director of the Office of Supportive Housing. One of our recommendations when we spoke to Javier and his team about, what are the gaps at the reentry center or diversion and reentry center, and what are some, easy things that we can do to help people prior to exit or when they come to the reentry center. And we think what's needed is an introduction of housing problem solving. So if you can imagine, housing problem solving is a conversation where, and oftentimes we find that some folks have a connection to a family member, have a partner, and it's a phone call. So housing problem solving isn't money. It is very light touch case management that helps the person problem solve their way so that they're not waiting on an assessment list when they can literally make up with their partner, they can reconnect with family, and that conversation doesn't require a professional person to do that. You don't have to be a rehabilitation counselor or have a certificate to do that. We offer the training that Javier was talking about, and making those linkages we have found is an easy way that doesn't require additional resources. The challenge is, as you know, in our community that we have 10,000 people who are unhoused.
Yep.
Every program has their limitations. When you look at the outcomes of those that are served at the reentry center, have an assessment, and in the data that Javier shared, 62% or so need permanent supportive housing.
Right.
And we have been increasing that number and capacity over the last 10 years in our community, both in building housing, but in providing tenant-based rental assistance and supportive services in a market that is very competitive and difficult to get landlords to agree to take our clients, to be honest. So the angle and the opportunity that we've been talking through with Javier and his team is what are the kind of low-hanging fruit items that we can do? Because if you are exiting and you go to the reentry center and we say to you, here, take this assessment for housing, we're going to put you on a list that you're never going to be called upon,
Right.
and then send you away, that is not a reasonable way of treating somebody. And so what can we offer? It's making those connections with family and, in some cases, as I mentioned, a partner or a friend that they can go and maybe it's not ideal, maybe it's house sharing, maybe it's sleeping on a couch, but they're not on the street.
Thank you so much for that. And really what stands out to me so much here in this conversation is the work between our departments and across the county that I think makes us, if not as effective as we always want to be, certainly ahead of the game always. And lastly, to my earlier comment on how useful the AB 109 population statistics are for informing strategic decisions. Can you help me understand, Javier, why our goal to reduce recidivism in the reentry network strategic plan only focuses on the AB 109 population, which I think, and please correct me, I think it's a very small percentage of our overall population. And in the update to the strategic plan, should we and can we be looking at the overall population or at least some kind of representative sample?
Yes, I'll definitely begin answer your question. I'll then turn it over to Chad to add additional information. In terms of the impetus of the AB 109 population was back in 2011 with the Public Safety Realignment Act being implemented, we focused on the AB 109 population because we had the system in place to look at the data. And so over the years, we just continued just looking at the AB 109 population. Part of what's required by the state is through the Community Corrections Partnership, which is chaired by our Chief of Probation, is to report on the data on the AB 109 population to ensure that we continue, of course, receiving the AB 109 funding, but also to show the success rate in terms of sending less people to state prison, which then entails an increase in growth funding allocation, which the county has been receiving.
Right, got that.
So that's, yep. But moving forward, we could definitely work with our stakeholders, probation and pretrial, to look at additional populations, and that would be a heavy lift because we would have to work with TSS to look at those models in terms of recidivism for probation clients that are not AB 109 designated, and also for pretrial.
Yeah, we only do heavy lifts here. But I think since it just very, very ballpark, what percentage of our population on any given day is AB 109?
I believe that's actually in the dashboard. I don't remember it off the top of my head. Looks like it ranges from 15% to 11% over this last few quarters.
Okay, so it's very small. So really to look at the effectiveness of our diversion, no entry, all the things we're doing, we really need analysis on that population. I'm going to finish by responding to the requests for direction that were in the ledge file with a proposed motion, and you'll tell me what you think. So just appreciate that you gave us options. Some I think are better than others. I'll start with option 3, which is to engage a consultant to prepare a new plan. I definitely don't see that as a necessary investment, given that the board, of course, recently approved additional admin positions for DRS to conduct this kind of work. And I think also a contract would really delay the timeline that you've outlined, and I would be surprised if we could have a new plan ready by the expiration of the current one. Regarding option 2, to direct staff to prepare a survey, it is always critical that we center decisions around the voices of justice-involved community members and those that are working directly with them. which I think we generally do a good job of. We do have currently a lot of contact, a lot of content, a lot of community input between the strategic plan, the current strategic plan, the recommendations from the 10-year AB 109 report, the alternatives to incarceration work group, and all of that I think really needs to be sorted and brought together. And as an add-on, I would recommend that DRS staff conduct additional outreach only on specific questions for clarification as those are needed. So my motion would be a recommendation that we move forward with option 1, which is to direct staff to create a new justice reentry plan considering the county-wide strategic framework incorporating the 10-year AB 109 report's recommendation, an analysis of the county agency's strategic plans and alignment of the recommendations and strategies from the ATI work group recommendations implementation plan. And I would look for a second. Judge Manley seconded.
Let me see if there are any other colleagues who would like to make comments on this body of work. I see Aaron kind of leaning in, and other chief. But Aaron, you want to go ahead, and then we'll go to Nick.
A quick question, and I apologize if I missed it while I was out of the office, but it sounds like there was some discussion regarding the ATI implementation work plan, and is that settled, or are we assuming the final product is what you're looking to incorporate?
The final product.
Thank you. And then Chief?
Yeah, thank you. A lot of discussion about AB 109 and probation clients, and definitely interested in that in Javier's report. We will be coming before Public Safety and Justice in December to do a snapshot report on our AB 109 clients and recidivism, and we'll also request to come here as well so that we receive the same information. What I can say about our AB 109 clients is we did a comparison study on the state's recidivism and used the same metrics that they used, and I wanted to pull out our local clients here just to see, hey, it sounds like we should be doing better than that, what I saw, and certainly that was the case, and we'll certainly bring that forward. And it's really interesting to see it's a 2-year snapshot post-release for convictions, and in 2021, that dropped to 26%. And statewide, it was 45%. So there's some good work that's being done in this county with Javier's folks and all the reentry network. I'm sure that there's also some things to look at when it came to COVID and all the measures that we put in place, and so I'll be interested to see post 2 years from this. But the reasons why the convictions and rearrest and recidivism were very interesting, and they weren't for substantially higher level of offenses. They were mostly drug and property crimes, and these are folks who had been released from prison, and so they're not recidivating at the same level that they came out to, and so the work that's being done with folks is certainly helping, but I can tell you that substance use is still a key component from both the men and the women when it comes to their principal service needs and how they get involved back into the justice system. Substantial, 70–80% of rearrests of men and women are struggling with substance use, and housing certainly has been mentioned, and that's not news. When 46% have housing and the rest of our folks really don't, whether that's temporary housing, whether they're living in a car, couch surfing, or THU. So these are not new issues, but I just wanted to raise that sunshine on those issues specifically to our PRCS clients, and we'll come back in December with that report.
Thank you. Anybody? Yes.
So my name's Christina Yee, and I employ 7 caseworkers, 3 for faith-based and 4 for service navigation. And I just wanted to comment on some of the housing issues that were mentioned. It's not always easy to place individuals coming out of incarceration with friends and family, because oftentimes those are the very same toxic environments that cause them to sometimes get incarcerated in the first place, so that's not always the best option. When we can do that, we really do that. However, sometimes we have to pay rent to those family and friends, and sometimes we have to really use our judgment to find out if we're being exploited with money or if they're really trying to help the individual. One of the other gaps in services are housing for 290s. They're a small population, but there have been some providers and some programs, I think, that are no longer available to house 290s, so that is always a challenge. Housing for women with children. There's not enough housing options to house women coming out of incarceration, which we all know. Also, I wanted to speak about some of the services in South County. There are very limited options for individuals that live in the South County area, and so that becomes a real challenge, and the only way for them to safely get housed is to house them in San Jose. But when they got a caseworker at the South County Reentry Center, it's difficult. It causes challenges for them to be coming back and forth, and then for them to stay connected with their family in the community. I'm sure with the expansion of the hours in South County, I'm sure that trying to find more resources and fund more resources in South County would be great to see for our clients out there. Also, a couple of meetings ago, they mentioned about having domestic violence classes, DUI classes, and there was one other type of class that clients also have to fulfill as part of their parole or probation mandates. And we've seen an increasingly low number of those being available to our clients, so they can fulfill that part of their probation. So we need help with that. The only option are those that are online, and I have to question whether or not it's really going to be effective. Are they really going to get out of what they need of these classes by doing these classes online from their phone? So it'd be great if we could have those services available to clients, either funded through RFP or some other viable source for them. Thank you.
Thank you very much. Seeing no other comments, I'm going to ask for a vote, but I did want to offer one perspective. I do think that there's a lot of value in having conversations with those folks who have become successful through the program. So I think when we're talking to people with lived experience, we both need to talk to people who've had challenges, but also to better understand what was in place for people who succeeded. And then one other recommendation I would make that I don't think necessarily is part of the strategic plan, but this is something, Sherry, that I'd be really interested in understanding. As you all are doing so much work to expand services, particularly around drugs and alcohol, I am really curious about what, if any, work we're seeing or research we've seen that gives people an option. If for example, if they're going to be incarcerated, whether there's an option for somebody who's going to be incarcerated to go into treatment as a real option that can happen right away. And even if somebody recidivates, if that's an opportunity, do they get a second chance to go into same-day treatment? And colleagues, the reason I'm asking that question is the research is really mixed about if you force someone into services, how well they do. And yet, so many people that I've talked to that have had success had some interaction at some point, either with law enforcement or a family member who sort of woke them up and they entered into treatment. And one thing I want to make sure of is as we're making it easier for people to make choices, that the choices are actually real and meaningful. So if someone really wants to get clean and sober and there's no place for them to go, that's not really a real option. And in some instances, the only option they may have is being incarcerated, and that's really not where we want to be either. So I know you all are working on it. I know we're going to have a lot of conversations about it, but from a research perspective, and this goes back to how you get information, we should be asking people what worked for them. What worked? And by the way, what didn't work? And just one point on this family situation, one of the requests I've made is that we make sure we have family finding in every major body of work we're doing, because it is not, I don't believe it's our responsibility, government's responsibility to, like, our job is to strengthen family relationships, not to impede them. And I think some of our policies, I think what you just said about how far people have to go to be able to connect to their families doesn't make sense. But for a lot of our families, they're so under-resourced that having another human being in the household, even if it's on a couch, eating, being part of that household, has a cost increase. And one thing we heard from one of our members with lived experience years ago was they said if the person had a little bit of resource to offer the family, back to the point you raised, so that they don't feel like they're a burden, because the other thing that keeps people from asking for help is shame. And it's still a real thing, even if President Trump doesn't have it, most of us do. And so we have to be really thinking in a meaningful way about how human emotion works. So what I would say is that may be, instead of a survey, that may actually be a few focus groups. And that I agree with Susan, like we don't need 10 more thousand consultants. I think you all are smarty pants, and frankly, what a lot of consultants do are giving you back the information you gave them without analysis. So I'm tired of reading those reports. But one area I do think we could use outside help is to actually do those focus groups, so they really are without our bias or influence, both for people who've had success and people who have not had success. So that would be just an idea for you all. So seeing no other lights, I'm going to ask for all those in favor of the motion on the floor, say aye.
Aye.
Any opposed? Any abstentions? All right, we're going to go to our last item.
Supervisor Chavez, just one clarification. So I misspoke on the recidivism rate. So in order for us, I mentioned that we would have to collaborate with TSS, but we would also have to collaborate with the Office of the District Attorney and County Counsel to get approval of any recidivism rate analysis, because it's coming from the Criminal Justice Information Center. Just wanted to put that on the record.
Why would that be super secret?
No, we just have to get approval through.
Oh, you just mean like the bureaucratic stuff?
Yes.
Okay. Oh, all right. I just wanted to make sure, because Susan was asking if there was a reason or a rule. It's not a rule. It's just us getting. All right. That's awesome. Okay. So everybody good? We're going to go to our last item, item 6, and this is a report on relating to the discharge planning and placement for high needs women. Thank you.
And I'm going to turn it over to Chad Martins here.
Good afternoon, supervisors, Reentry Network members. Chad Martins, Assistant Director with Diversion and Reentry Services. We do have representatives from Beaver Health. Robin is joining us again, and then we have representatives from Custody Health and the Sheriff's Office if you have any questions for them. So this is an update on our efforts serving women leaving county jails. So a quick background here. About a year ago, or over a year ago, in June 2022, we came to this body and presented kind of a reworking of our initiatives with women in custody. We had a GROW program and a gender-responsive collaborative work group, and so we kind of restructured that into a three-pronged program or initiative where we have an executive level group that works on assigning staff and approving work from the top down. And then we had the kind of new version of the Gender Responsive Collaborative, which is a work group focused on a women in custody work plan. And so they're really working at the operational program level to improve things in custody and the transition from custody to community. And then the newer element was the Women in Custody Case Conferencing Group, which meets every 2 weeks and reviews every woman who's scheduled for release in custody. So I'll start with the update for the case conferencing group and then move on to an update for the Women in Custody work group. So we ran this analysis August 31st. So as of August 31st, there had been 215 women that this group had reviewed and case planned around. That breaks down to 21 who were in custody on that day and 194 who had been released. So on the left, the table shows us a snapshot for what plans were in place at the time we did the analysis, and so you can see there's a breakdown there with 9 people, or 9 women still having planning in progress, meaning they were engaged, but maybe they had multiple options, and so they hadn't had a final option, or they were planning to be engaged soon. When it comes to the women who were released, and that 194, behavioral health treatment is typically the most common destination for them to be, or the most common plan for their release. And then I can go down the list. 7 went to alternative sentencing programs. 20 went to our service navigator, or were planned to go to our service navigator. 27 were engaged, but were found not to be eligible, meaning they were going to be released to a prison, or they were going to move out of the county at release. 21 were not interested, and when we say that, it means that they were, they assured staff that they were very low need, they had housing, they had support with family, or maybe they did have a need, but they were just not willing to engage at that time. And so those women are provided with resources, but they didn't have a specific plan for a wraparound support in place. 16 had a confirmed plan. This basically means that we didn't have a release for them, a release of information. Rehab officers were able to tell us there is a plan in place. You don't need to send the service navigator in, but we can't tell you what the exact plan is. So those women did get services. We just weren't able to capture through this forum what the disposition was for that. And then we have our unknowns. Those are mainly from the earlier iterations of our case conferencing when we were still piecing together the data collection. There are some women who we knew were engaged and offered services, but we weren't able to capture what exact plan they had in place, or if they had a final plan in place. And then we have the women who are short stays. This is our current largest gap in serving women right now. Some are coming into custody for a couple of days and then leaving. So many of these women are engaged and offered services, but for this forum, since we only meet every other week, by the time we meet to review them, they're often out of custody and already in the community. And so we do capture them just to kind of show when they show up on our list, we do capture them, but we're not able to capture outcomes for many of the women who have short stays. And then this next slide is a kind of a more in-depth breakdown of those 194 women who were released, just to give some additional context. So out of the 194, 144, that's the 50 that were short stays missing there, were in custody long enough to be reviewed. And of the 144, 48 were not eligible, were not interested. So that left us about 96 women to really focus on case conferencing and getting a final plan in place. And then we had the 13 women with an unknown. So that left us with about 83 women who were being released to the community, would reside in Santa Clara County, and were receptive to services. And all 83 of those women were released with a plan in place. So we are, our partners are doing a really good job engaging women in custody, custody health, rehab officers for the sheriff, and of course behavioral health services. But there is a gap with the women who aren't in custody very long, and there is a gap with that plan in place carrying over into the community and sustaining engagement. The 2 bullets to the right of the slide show some additional information, and there is a more detailed breakdown in the ledge file. But we asked our service navigator, the one that's dedicated to this group, to run the list and see how many women they formally enrolled and served. That was 13 women, and I believe there were 20 that were planned to go to them. So there was 7 or so women who didn't make it to them. And then we asked behavioral health to run our list to match it to their database, and they were able to confirm that 24 women were admitted to behavioral health treatment within 90 days. And there is some disposition breakdown in the report as well. So that brings us to our Women in Custody work group, which is the middle level work group. And we brought a Women in Custody work plan, a final work plan in June of this year, 2023, to this body. And that was a culmination of a retreat in February and a lot of work between stakeholders to kind of create a plan that ended up having 9 buckets, which are to the left there. And a lot of the recommendations or the action items in that plan are also based on the Moss report that was provided to the Office of the Sheriff. So this slide is really just some updates since the last meeting where we provided updates. So really between June and September. So we are, as Javier touched on earlier, really looking to utilize the Mission Street Recovery Station as much as possible. A part of that is now allowing referrals from jails for late night releases. So anybody, man or woman, can access this if they're referred from custody staff. So if they don't have anywhere to go, which is particularly useful for women, they can use this as a quasi-shelter and then go right next door in the morning to access services. For clothing, we did provide some clothing in May and recently approved funding for additional clothing. And we are currently hosting our annual 5K fundraiser, which is actually this weekend, and we're on track to have record in participation. So we're hoping that'll lead to us being able to buy a lot of clothing for people leaving custody, but also our general reentry clients. And one of the things that our work group has been working on the last couple meetings is the materials bucket. And so we've kind of finalized a binder or packet with various information. It's a multi-use packet. It has resource information, discharge planning documents, activities like journaling activities, and self-help activities. And so that's being finalized now. We have it put together. It's being reviewed, and we hope to distribute that soon. The Sheriff's Office, in regards to visitation and common areas, is looking into murals and furniture and other ways to beautify and make these environments more positive and welcoming. The Sheriff's Office also recently participated in a Train the Trainer gender responsive training. And so there are more and more staff becoming trained to become gender responsive as well. And finally, adult probation is planning a trauma support group, and they're currently in the research phase looking at best practices and existing models and are looking to implement that in the near future. So those are the updates we have for you, and we're also happy to take any questions.
Great. First, I'm going to see if there are any public speakers on this item.
There are currently no requests to speak.
All right, I'm going to close the public hearing component. I'm going to look to my right and see if anybody wants to. Molly?
Just a quick question, thank you. Chad, on the materials, the resources you're going to hand out to women, do you have somebody set to keep those updated? I know we've had some trouble kind of keeping up with which shelters are open and who the right person in the county is to contact.
Yeah, so I think our office is taking the lead on keeping this kind of a living document. We'll have different iterations of it, and we'll bring it back to the work group. And of course, one of the steps we have left is giving this initial version to women in custody and having them tell us what else we should put. So this will be a pilot version, if you will, and then we'll keep improving it as we go. But I think that'll be my office leading that effort.
Great, thank you. Wes?
I was wondering, do you have any data which, maybe in behavioral health, that includes faith-based or discharging them with, because it's such a big factor when they're in the jail. Their spirituality is very important. So is there something within what you're reporting, bringing in the CIC, which is corrections and chaplaincy?
Well, we do have pretty robust data from our faith-based contracts and those programs. They, as Christina knows, they have to fill out some pretty tedious spreadsheets, but we're more than willing to work with you and see how we can fit it.
Yeah, I'd like to, maybe they could be discharged to someone from the church or whatever that it may be. I don't know. That's something we
absolutely.
Like
and part of that is how we expand this, and kind of that's what we're doing with our current 7 programs. We have the 4 faith-based programs, and we also have the 3 service navigators. Currently, we have a dedicated service navigator, which does very similar work. But as we move forward into increasing our presence in custody, working on discharge planning, all of these conversations are happening at higher levels, but part of that is using all of these programs to fill in the gaps and support. So there's definitely a lot of planning there to be had.
Well,
So
I'd like to talk to you about that sometime.
Great, and I apologize, we're going to wrap up because we just lost quorum. And when we do that, we have to end our meetings. So I want to say just a very sincere thank you to the staff. This is incredible work, and I'm sorry I didn't get a chance to give you more feedback on it. I wanted to thank the Sheriff's Department. You all have been just amazing to work with. Our next meeting is in December, and I will be reaching out to all of you to see, I think we're going to make some changes to the composition of the board so we can actually continue to get work done. So thank you all very much.
Thanks, Kevin. Good timing, because I was about to run out of batteries.